Welcome to the Capital Health Insights podcast, where we talk with primary healthcare professionals in the ACT to learn about their work and the support that is available to our community.
Hi everyone, my name is Jessica Houston, the Service Relationship Coordinator here at Capital Health Network, ACT's PHN. And I'm here today with Dr. Tara Frommer from Sexual Health and Family Planning ACT.
Good afternoon. Tara, would you like to introduce yourself and tell us a bit more about your work with SHFPACT?
Thanks, Jessica. So my name's Tara Frommer, and I'm one of the Senior Medical Officers at Sexual Health and Family Planning ACT, which we affectionately refer to as SHFPACT. And I'm also the clinical lead for our pelvic pain service.
Perfect. Thank you, Tara. Can you tell us a bit more about what services are provided at the clinic and why these are important?
Yeah. So in regards to pelvic pain, there are multiple components to what our organisation provides. Firstly, we have our pelvic pain clinic, which provides direct clinical services to patients who are experiencing pelvic pain conditions, which might include things like painful periods, persistent pelvic pain, endometriosis, or painful sex. Now, this service plays a really important role, particularly within the ACT. I know for myself, as a GP working within the ACT, I really understand how overloaded our specialty services are in this area and how difficult it is for GPs to access assistance for these patients. And Jessica, you might be aware, pelvic pain is really common, with an estimated 25% of patients assigned female at birth experiencing pelvic pain at some point in their life. So it's a condition that GPs and other healthcare providers really often encounter. However, we know despite this, historically, very little of our training is actually dedicated in preparing us to manage these patients. So our pelvic pain clinic aims to support GPs by providing a subspecialty service, which is able to provide advice, education and management for these patients. The goal of our clinic is to avoid fragmenting care. And so we try and focus on being able to collaborate and support a patient's own GP. Currently, the extent of our funding for our clinical service does allow us to provide a specialist nurse service without cost to patients. And we also have very generous discounts available on our fees to see doctors if required. It's also important to note our pelvic pain service also aims to provide additional services in the area of education and support to healthcare providers in our region. One of the really exciting ways that we're doing this, Jessica, is by establishing the new ACT Pelvic Pain Network. The Pelvic Pain Network is a community of practice where healthcare providers working in the area of pelvic pain can come together for educational opportunities and to network with other providers in the area of pelvic pain, with that aim of really improving that collaboration and strengthening our referral networks that exist within the ACT for pelvic pain.
Sounds like a lot of work that you're doing. Can you tell us a bit more about how the network is ensuring that this level of collaboration will continue and grow over the years in the ACT?
So when talking about how sustainable our network is, I'd firstly really like to show my appreciation at the government funding we have received that has allowed us to be able to establish this new network. But really the ongoing viability of this network rests in the hands of its members. So I'd also like to take this opportunity to thank the current members of our fabulous committee and all of our fabulous volunteer speakers who donate their time to keep the network running for all of its members. We do always welcome support from our members and has been very powerful to be part of such a passionate community of healthcare providers working in this space. And so it's a really important thing that we're thinking about is how do we make sure that that collaboration is really sustainable? And that's where the Pelvic Pain Network comes in. As part of our network, we run regular meetings, and in these meetings, we might provide education, discuss case studies, or simply provide networking opportunities to be able to meet other professionals that are working in this space, so we're not working alone. This allows our members to feel confident in managing their patients, but also to allow them to feel part of that larger team, hence preventing a lot of the burnout that people might feel. The network also provides regular newsletters to keep our members up to date with new information in the area of pelvic pain. And we also have a referral directory as part of our newsletters to help us further strengthen that referral network.
So how can someone sign up and join the network?
So our ACT Pelvic Pain Network is open to predominantly upper registered healthcare workers that work in the area of pelvic pain. Also, any providers that are interested in our network, they can sign up through our link, which CHN, I believe, Jessica, will be able to put up with this podcast. It's important to note that whilst we do have a referral directory, that is optional for our members. So you can sign up and still get all of the educational opportunities and networking opportunities, but you don't need to be on that referral network to be a member.
Thank you for advising. Can you tell us of some examples of good news stories from the work of the Pelvic Pain Network for both consumers and health professionals?
Yeah, absolutely. So obviously, whilst our network focuses on supporting providers, there are obviously many flow-on benefits to our patients that have pelvic pain. Networks like this support practitioners in feeling confident and having the skills to be able to manage pelvic pain, but also providing that team environment which helps reduce those rates of burnout. The other additional benefit, both to practitioners and patients, is when we strengthen those referral networks, we actually also improve the quality of those referrals for patients. So we ensure that patients are more likely to get the care that they need when they need it. So whilst many consumers or patients may not be directly aware of our network, we know that we're getting lots of positive feedback from our members that the network supports their work in pelvic pain within the ACT. And personally, a lot of my patients have been really thankful for those more personalised referrals that I've been able to do as a result of being part of the network.
How do you ensure that your model of care is comprehensive and covers all different areas of pelvic pain?
This is where being a network that collaborates is really important. We continue to adapt what we provide based on the feedback of our members. And we are so very lucky to have such a diverse group of members, many who have a lot of experience and skill and knowledge in this space. And we're always so happy to hear from them.
Right. And earlier you mentioned that you do quarterly newsletters as resources. How can we access these?
So anyone who signs up to the network will automatically receive those newsletters, and there are fantastic resources for practitioners working in pelvic pain. We put into those newsletters upcoming events, both our own and those that might be happening interstate or further afar. We also put in those newsletters new research and information in the space of pelvic pain, as well as information about particular providers. So we like to try and do a little spotlight on some of the great providers that are doing great work in the ACT.
Great. Thank you for that information, Dr. Frommer. Well, that was my last question for today. So I'd like to thank you for your time and for providing such valuable insights. We hope that ACT health professionals in our community can find this network as an important resource for pelvic pain management.
Thank you very much, Jessica, for having me.
Thank you for tuning in to this episode of Capital Health Insights. Tell us your thoughts about primary health care in the ACT by registering for My Say on the Capital Health Network website.